Today our topic is approach to the developmental delay. Here we're going to see about the definition, transit and the persistent developmental delays and what are all the age affecting factors that causes the developmental delay and the signs and symptoms, etiology and how we should approach to a child with the developmental delay like history, physical examination, investigation and screening. What is development delay in children? Child development refers to how a child becomes able to do more complex things as they get older. Growth only refers to the child getting bigger in size. In case of the developmental delay, this is the process when a child does not reach the development milestone at the expected times. It is an ongoing major or the minor delay in the process of development. Delay can occur in one or more areas, for example, growth of the fine motor, language, social or thinking skills. Development delay is not uncommon and occurs in 2 to 3% of all children. The term development delay is often used until the exact nature and cause of the delay is known. The significance of the delay is often only determined by observing the child's development over time. Some children have a transient delay in the development. For example, some extremely premature babies may show a delay in the area of sitting, crawling, and walking, but then progress on at a normal rate. Other causes of the transient delay may be related to the physical illness and the prolonged hospitalization, immaturity, family stress, or the lack of opportunities to learn. Persistent development delay. If the delay is they are developed persist, it is usually related to problems in one or more of the following areas like understanding and learning, moving, communication, hearing and seeing. An assessment is often needed to determine what area or the areas are affected. Disorders which causes the persistent development delay are often termed the developmental disabilities. Development disability is estimated to occur in 5 to 10% of the population with the enormous psychological, emotional and the economic impact on the affected individuals and the society. Studies have shown that the developmentally delayed children who are recognized at an early age receive more development optimization and greater gains than those who are identified later in life. The early recognition of the children with the development problem is therefore important. There are several disabilities in the classification of the development delay. Gross motor delay. This is a significant delay in the fine or the gross motor skills with no impairment in the other developmental area. Developmental language disorder. Significant delay in the receptive or the expressive language skills with no delay in other development domains. Global developmental delay. Significant delay in two or more developmental streams as measured by the appropriate standardized screening test. This term is reserved for the children less than 5 years of age. Cerebral palsy. Early onset non-progressive motor impairment with associated abnormalities in the muscle tone. Hearing sensory impairment. A reduction in the ability to hear the sound ranging from slight to complete the deafness. Visual sensory impairment. An optically or the medically diagnosable condition in the eye visual system that affects the development and the normal use of a vision ranging from slight to complete the blindness. Learning disability. The significantly lowered individual achievement than predicted by the intellectual ability as measured by the standardized psychoeducational test assessing the reading, mathematics or the written expression. Pervasive developmental delay, autism, impairments in the social skill, communication skill, and the restricted repetitive patterns of the behavior. Pervasive developmental disorders, not otherwise specified, autism spectrum disorder. Similar to the PDD, but not enough symptoms to warrant a PDD diagnosis. Developmental milestones. They are the set of functional skills a specific task that most children can do at a certain age range. The pediatrician uses the milestone to help check how a child is developing. Although each milestone has an age level, the actual age when a normally developing child reaches the milestone can vary quite a bit. Every child is unique. See this milestone checklist can be noted here. In this category, gross motor. This using the large group of a muscle to sit, stand, walk, run, etc., keeping the balance and changing a position. Fine motor. Using hands to be able to eat, draw, dress, play, write, and to do many other things. While speaking about the language, speaking using the body language and the gesture, communicating and understanding what others say. Cognitive. thinking skills including learning, understanding, problem solving, reasoning, and remembering. Social, interacting with others, having the relationship with the family, friends, and teachers, cooperating and responding to the feelings of others. Global development delay, that is delay in the two or more domains, often delayed in all domains. Specific development delay, example motor in the speech and language, they develop in the single domain. In 1 month, the movement milestone makes jerky, querying arm thrust, brings the hands within the range of eyes and mouth, moves the head from side to side while lying on the stomach. Head flops backward if unsupported, keeps hands in tight fist, strong reflex movements. While speaking about the visual and the hearing milestones, they focus as 8 to 12 inches, eyes banded, and occasionally there will be crossbar. Prefers the black and white or the high contrast patterns. Prefers the human face to all other patterns. Hearing is fully mature. Recognizes the sub-sounds. May turn toward the familiar sounds and voices. While speaking about the smell and the touch milestone, prefers the sweet smell, avoids bitter or the acidic smell, recognizes the scent of his own mother's breast milk, prefers soft to coarse sensation, dislike rough or abrupt handling. Movement milestone, raises the head and chest when lying on the stomach, supports the upper body with arms when lying on the stomach, stretches the legs out and kicks when lying on the stomach or back, open and shuts the hand, pushes down on the legs when feet are placed on the firm surface, brings hand to mouth and takes the swipe as a dangling objects with a handling grasp and shakes hand toys on. Visual and the hearing milestones, watches the face intently, follows moving the objects, recognizes the familiar object and people at the distance, starts using the hands and eyes in coordination, smells at the sound of your voice, begins to babble, begins to imitate some sounds, turns the head towards the direction of a sound. In case of 3 months, social and the emotional milestones begin to develop a social smile, enjoys playing with other people and may cry when playing stops, becomes more communicative and expressive with the face and body, imitates some movements and facial expressions. Movement at the milestone, rolls both ways, front to back, back to front, sits with and with, then without, support of her hands, supports her whole night on her legs, reaches with one hand, transfers the object from hand to hand, and uses a raking grasp and not a brain servant. In case of 7th month, there will be the visual milestone. They develop the full color vision, distance vision matures, ability to track moving objects improves. Language milestone, response to the word name, begins to respond no, distinguishes the emotions by tone of voice, respond to sound by making sounds, uses a voice to express the joy and the displeasure, babbles the chimes and consonants. Cognitive milestone, they finds partially hidden objects, explore with hands and mouth, struggles to get the objects that are out of reach. Social and the emotional milestone, they enjoys social play, interest in the mirror images, respond to other people's expression of the emotion and appears joyful often. In 12th month, there will be the movement milestone, gets to the sitting position without the assistance, crawls forward on the belly by pulling with the arms and pushing with legs, assumes the hands and knees position, creeps on hands and knees, supporting the trunk on the hands and knees, gets from sitting to crawling or prone, lying on stomach position, pulls herself up to stand, walks holding on to the furniture, stands momently without the support, may walk 2 or 3 steps without support. Milestones in hand and finger skills in 12th month, uses the pincer grab, bangs 2 cubes together, puts objects into container, takes the objects out of the container, lets objects go voluntarily, works with the index finger and tries to imitate the scribbling. In 12th month, the language milestone is pays increasing attention to speech, responds to no, shakes head to no, says dada and mama, uses exclamation and tries to imitate the word. Cognitive milestone like they explore the objects in many different ways, imitates the gesture, begins to use objects correctly. Social and the emotional milestones, shy, cries, enjoys imitating people, shows specific preferences for people and toys. In case of 2 years, they walk alone, stands on tiptoe, begins to run, kick a ball. Milestone in hand and finger skills like scribble spontaneously, build tower of 4 blocks, might use one hand more frequently than the other. Language milestones like use 2 or 4 word sentence, follows the simple instruction, repeats words overhead in conversation. Cognitive milestones like finds the object even when the hidden under the 2 or 3 covers, begins to sort by shapes and colors, begins make believe play. Social and the emotional milestones imitates the behavior of others, especially the adults and children, increasingly aware of herself as a separate from others, begins to show the defined behavior. Increasing episodes of a separation necessity towards the mid-year and they fade. Movement milestones hops and stands on one foot up to 5 years, kicks the ball forward, throws the ball overhand. In case of milestones in hand and finger skills, copy squash, uses scissors, draw circle and squares, begins to copy some capital letters. Language milestone tells the stories, uses the concepts of same and different. Cognitive milestones like correctly name some colors, recalls a party of a story, engages a fantasy play. Social and the economic milestones like plays with mom and dad, dresses and undresses, more independent, negotiates the solution to conflicts, often cannot distinguish between fantasy and reality. In case of 4 to 5 years, the movement milestones will be stand on one foot or 10 seconds, swims, climbs, may be able to skip. In hand and finger skills, they usually care for one toilet needs, print some letters, draw person with boarding. While speaking about the warning signs of a children who have physical development delay. Newborn to 2 months, after 2 months doesn't hold his head up when you pick him up from lying on his back. After 2 months, still feels particularly stiff or floppy, overextends his back and neck as if he is pushing away from you. After 2 to 3 months, stiffens, crosses or seizes his legs when you pick him up the trunk. In 3 to 6 months, he doesn't grasp or reach for toys, can't support his head well, isn't bringing an object to his mouth. After 5 or 6 months, still he has an asymmetrical tonic neck reflux. When his head turns to one side, his arm on the other side will straighten with the opposite arm. They can't sit with help. They reaches out with only one hand while keeping the other twisted. They doesn't roll over in the either directions. In 7 to 9 months. At 7th month, he has a poor head control when pulled to the sitting, unable to get objects to his mouth, not reaching for object, doesn't bear some weight on his legs, can't sit independently. After 10 months, crawls his lopsided manner, pushing off with one hand and leg while dragging the opposite hand and leg. At 12th month, this is not crawling. At 12th month, they can't stand with support. In 12 to 14 months, by 18 months, they can't walk. After several months of walking, doesn't walk confidently or consistently, walks on twice. After his second birthday, its growing is less than 2 inches per year. 36 months, they fall frequently, are unable to use the stairs, drools persistently, and can't manipulate small objects.